Last year, nearly 1,000 people died from overdoses in the state of Missouri, and experts say they are seeing more and more young people become addicts. 41 Action News reporter Stephen Dial shows us why some hope new funding will help.
A younger crowd are getting into it. It's, guys fresh out of college.
Nationally, the CDC says last year more people have died from a drug overdose than car crashes and gun violence combined.
I'm excited to be off probation next April.
Jo Marie is a recovering addict. Last year, she told us because of her addiction, 2 of her children were taken from her. Months later, she's now sober.
Don't be afraid of the consequences, because if you continue in doing what you're doing, you're either going to die or the consequences are going to be worse.
A study by First Call and the KU School of Social Welfare found there's been an increase in drug deaths in Jackson County. And in Johnson County, a higher percentage of young people are abusing drugs. Micah Hain is with Welcome House, which offers residential sober living programs. Hain says they are helping more and more Johnson County youth.
We've had guys that come in and maybe have been on an opiates for maybe a year and a half, and they've already pretty much lost everything.
Some argue more funding will help.
The #1 cause of accidental death in America today is drug overdose. This bill provides $3.8 billion toward targeted opioid funding.
Today, Senator Roy Blunt announced $31 million in federal support will come to Missouri. Kansas City Care Clinic and Swope Health Services will both receive more than $280,000. Hain says funding is key, but so is education.
We see the numbers are rising, but we don't see numbers rising of people asking for help. It seems like people aren't aware that there's help out there for that.
Money, education, and community support, all tools to help stop an epidemic that impacts so many lives. Reporting, Stephen Dial, 41 Action News.
In Kansas, more than $6 million fund programs to help people with substance abuse. According to the Department of Health and Human Services, that money has been split between 18 different health centers across the state.